our system of paying for healthcare, it lags our technological innovation by a lot. And so for the most part, many providers are still paid on what we call fee-for-service basis. And they're paid on the volume of patients they see, the volume of services they provide. So that means that has to be their whole focus, moving patients in and out. And it hampers a lot of their thinking about how to do things better because the system is what it is. We need to get a healthcare system and a way of paying for care that catches up with where we're going in technology.
What is the problem you're trying to solve? So do you know healthcare? Number two is, what's the evidence? That's the question that all doctors ask, all administrators ask. And that unfortunately puts on a big burden, which means you have to prove it. And that means you have to done an observational study or a proof of concept study or something. And that's what startups are doing. And I think it's really good.
We're able to empower the physicians, we're able to empower the nurses, because how can they direct patient care if they don't understand how nutrition impacts their patients any more than the patients do? So while we think it's great that there's all of these wellness programs out there, if the clinicians can't understand and utilize nutrition to impact that patient, it's meaningless.
The training of a physician is an incredibly complex process, not just because of the information, but because of the human interaction that exists in a patient care setting. And so inserting a technology-based tool or a physician support tool is going to really need to happen in a way that maintains the integrity of that relationship.
The coordination of care for vulnerable patients in the safety net is incredibly difficult because for the most part, they tend not to have a usual source of care. They may see a minute clinic in a Walmart. They may then go to a community health center. They may then go to another community health center. And we don't yet have systems that can track patients from place to place.
I would encourage us to be adaptable as people. I think that the future is unpredictable in healthcare. When most people in America believe that if we need a new organ, we can grow it in the lab. This is what they think is going to happen. It's happening. You can tell the medicine is going to change a lot. So I would say be adaptable. And you need to take it upon yourself to look forward and to see where your field is going and where your next job will be.
The CIO of the old is gone. The CIO of the new is very transformational. Historically CIOs didn't want to ever do anything leading edge, cutting edge. We always wanted to let everyone else go first. Now in the market I'm in, we need to be leading edge. We need to be implementing as quickly as possible.
I think patients need to have engagement with their providers. That's really at the core of patient requirements. They need access to healthcare. They need healthcare to be readily available. They need it to be affordable. They need it to be accessible. And they need it to be at higher quality. The healthcare systems themselves have been evolving over the last decade, and the evolution has taken place from mergers and acquisitions as well as partnerships, and we see that across multiple geographies.
The exciting part is the role that a patient and the interaction that you're going to have between the patients and providers is going to be profoundly different. So really it's how do we embrace that, to not take it as a challenge, but to embrace it and say the more involved you are, the better.
I think people enter healthcare with a lot of passion, right? So you see a problem, you have a family member or a close friend who is struggling with the healthcare system, and you really want to make the world a better place. And I think a lot of people see their skills in engineering or marketing as something they could really bring to our industry. I find that they struggle with not understanding with how the industry works and how to work with us. And without understanding what the current market is, what your business models need to be, what the pain points are, it's really hard to grow into an industry that's quite old-fashioned.
I think the most important thing to start with the patient and make it really easy to get care at the most appropriate setting at the right time. So you think of all these new models emerging, whether it's retail care, consumer care, telehealth, provider, especially specific networks, ambulatory surgical centers. I really view that as a spectrum, a continuum, and I think what we need to do is be designing for the ability to seamlessly interact with that spectrum such that we can pick the right type of acuity, the right type of value, the right patient provider match at the right moment in time in a much more seamless way than we would do it today.
I think one of the big evolutions that we've seen in the EMR and those, has been, the EMR, when they started rolling them out, is really trying to mimic paper, so that the adoption level was really high. So if we make it look like paper and look and feel like paper, then we're going to adopt it, and physicians and clinicians and everybody else will understand it. But when you do that, you take away the inherent benefit of what it is, which is a true digital record. And now, really, when I walk in as a provider or as a nurse, what I want to see is really the vital things that are important that I need to know, and I want that to be front and center.
Layers of cake and slices of cake. We've built interoperability as a layer. We're exchanging data around, but to make the cake reference, nobody buys a layer of cake, people buy slices. And I think we need to think about those interoperability initiatives, structured standards, much more of end-to-end experiences within specific use cases. We as humans, cognate in narrative, in prose, in stories, and not necessarily discrete data. And how do we bridge that world of machines and discrete data with a narrative? I think is the most important thing that's come out away from the last couple of years of where interoperability and platforms have failed and where we need to be focusing on.
We have seen a lot of change in the last 2 to 5 years, and we're really excited about what's happened. But I think the next 10 years, there's going to be an explosion of data, explosion of technology, and a lot of these systems are finally big enough to come together. And I think our healthcare in 10 years is going to be pretty impressive compared to today.